Here is your patient. Okay, so if you've read and understood, considering its surgical pathology station, please tell me in this patient's condition, what might has led to this situation that this patient is suffering from now?
As patient is a heavy smoker, most probably it is Berger disease that has caused her to have gangrene of big toe of her.
Kindly define what is Berger's disease.
Berger disease is vascular disease, peripheral vascular disease, which is caused by heavy smoking and atherosclerosis of the medium to small arteries, causing necrosis or gangrene of the foot or
Okay, can you
toes.
please define the term necrosis?
Necrosis is unregulated accidental cell death caused by the damage of the cell membrane or the failure of the iron homeostasis.
Yes, which occurs by, what is the process called by which necrosis takes place?
Necrosis takes place by the process of, you mean to ask the pathogenesis of it, right, ma'am?
Yes, by autolysis. What do you understand by the term autolysis? Is it energy driven or what type of
Yeah.
process is it?
Because of iron homeostasis failure, there is influx of calcium and into the mitochondria and cell, and the rupture of the lysosomes, along with the enzyme.
Not enzyme, ions,
And
hemostasis. Because of cell membrane gets disturbed, so that results in damage or loss of iron hemostasis. Okay, what are the different types of cell death that you are aware of?
one is necrosis, another is apoptosis.
Okay, what is the pathogenesis behind necrosis?
Necrosis is a pathological problem caused by the insufficient blood supply
Yes,
or ischemia,
yes,
with when there is irreversible cell death, the necrosis
yes.
occurs,
Then,
and apoptosis is a programmed cell death,
okay.
which is physiological. Uh,
In necrosis, there is a swelling of mitochondria, which leads to influx of calcium, and then
and then cytochrome C activation, which leads to the cell death.
no, you have to read this again, please. Okay, what are the different types of necrosis you are
Yes,
you know about?
cytotoxic, liquefactive, and there's third one more.
There are four actually: coagulation necrosis, liquefaction necrosis, gaseous necrosis, and fat necrosis. And what are the difference among these? Which exactly has occurred here in this situation?
This is
This is
coagulative.
gangrene. Okay, what is gangrene?
Gangrene or gangrenous necrosis is necrosis of a tissue or an organ due to the insufficient blood supply.
Yes. When is it called critical insufficient blood supply?
When the tissue or the organ is about to die, that is critical.
What are the different types of gangrene you can tell me about?
There is wet gangrene and dry gangrene.
Okay.
Wet gangrene has adjacent tissue hyperemia, and there is also superadded bacterial infection or fungal infection.
And there are many other. Tell me about the prognosis, or macroscopically, what is the difference? Mechanism. Wet gangrene occurs mostly on when there is obstruction of venous system, whereas
Okay.
dry gangrene occurs in arterial occlusions. So in this condition, what would you suggest the patient has suffered from wet gangrene or dry gangrene?
Dry gangrene.
Okay, so arterial
Occlusion, yes.
occlusion has occurred. Okay, right. And there are other many differences of fate and then pathogenesis as well. All right, in acute ischemia, so there is wet gangrene, chronic is dry gangrene. Anyway, please tell me what are the risk factors which has contributed in this case, in this stem, which has contributed to this situation of the patient?
These are modifiable risk factors that
Yes.
smoking is one of that,
Yes,
and
and
diabetes is also a modifiable.
yes,
In
anything
this,
else?
in this patient, as she is a
The-
construction worker and a heavy smoker,
So,
only the smoking is the risk factor which has caused her to have
which
dry.
is apparent. Otherwise, there could be even family history. There could be even increased lipid profile or deranged lipid profile. There could even family history of hypertension. Diabetes is not mentioned, right? But yeah,
Yeah.
okay. Right. What more? Okay. What is the management that you can suggest this lady?
As if it has developed acutely, we can give her 5,000 units of IV heparin and put her on maintenance 18 unit per kg. And for the toe, as it is unviable, we'll have to amputate.
Okay. Right. Right. Okay. That is the management. So who would you involve in the management of this patient?
I will involve plastic surgery and vascular surgeon and orthopedic surgeon.
Okay. Okay. Right. And you'll also rule out her lipid profile, etc. Okay. Right. So what are the complications that you can expect if you don't manage the patient on time? What are the complications that you should be aware of?
The first and foremost would be sepsis. So we need to avoid patient to have her necrosed part getting infected. For that, amputation, urgent amputation is necessary. And further, we will do her investigations of her lower limb angiography, CT angiography, to look if the occlusion is the level of occlusion, and if we can only manage her conservatively or surgically through bypass graft or stunting.
Okay. How frequent or how soon should you be operating on the patient for amputation?
Um, within 6 hours.
Yes. Okay. For your information, just dry gangrene is not susceptible that much to infection as compared to wet gangrene, which is vein oriented. So yes, good. Thank you.
Thank you, ma'am.